Hello, I'm Dr. James Bogash, expert in health and longevity and creator of Bogash Life and Balance. Today we're going to talk about something that shouldn't come as a big surprise, but the biggest surprise is that we have spent 2.5 years not talking about things that we knew and now know through research that would be helpful for any type of respiratory viral infection, in this particular case, COVID. This was an interesting study looking at over 65,000 people in South Africa. They were all part of a program that they would, if they chose healthier behaviors and documented them, they would actually get points off either money back or insurance. I wasn't quite sure what that was. But to be considered as part of the study, people had to be tracking their exercise for at least 2 years prior to the pandemic. So we couldn't. It wasn't that people started exercising as a result of COVID, or which they should have been doing, or that they stopped exercising because things closed down. These were people that were overall very active, and they divide them out into low physical activity, like less than 60 minutes per week, moderate physical activity between 60 and 149, and high as 150 or higher. And they looked for COVID outcomes, so hospitalization, ICU, ventilator, and death. And the numbers were pretty, and they looked at them through between March 2020 to June 2020, so right in the height of the ancestral strain when things were probably the worst than they were, and the data was pretty impressive. Hospitalization risk in those with the highest level of activity, and keep in mind that people with moderate level activity also had protections, but they weren't as great as high. And they had a 34% lower risk of hospitalization, a 41% lower risk of ICU, ventilator 45% lower risk, and risk of death 42% lower. Like, these are, and interestingly enough, more powerful is that even these benefits were still achieved in people with comorbidities. So diabetes, obesity, and exercise alone was one of the more powerful tools to prevent bad outcomes. Again, shouldn't come as a big surprise, but it just, quite frankly, just pisses me off that we hear time and time again that, healthy lifestyle changes aren't going to make a difference. This is a pandemic. It's a novel virus. That's all crap. The research continues to support that the choices we make have an impact on your outcomes, both on diagnosis and on outcomes, and obviously death, which is an outcome. So why, from a public health standpoint, have we not been promoting these things from day one? We'd also have side benefits from things like heart disease and cancer, which are also lowered by exercise. There was no downside to public health taking a strong stance on exercise and getting out and moving more. Instead, we shut down all the avenues that everybody had an opportunity to use. Just didn't make any sense. So as always, I'll post a link to this particular study in the description. Make sure you like this video, share it with somebody who you think needs the information, and subscribe to the channel and get off your butt and start moving.